Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Serenitha. I'm Dr. Oliver. How are you feeling today?
Hi, Dr. Oliver. I'm not feeling too good. I've been experiencing pain in my lower back and left hip, and it's becoming difficult to walk.
I see. Can you tell me your full name and age, please?
My name is Serenitha Morgenstern, and I'm 24 years old.
Thank you. Can you tell me your address and the type of residence you live in?
Sure, I live at 26 Cherry Tree Lane, Winchester, Hampshire, UK. It's a single-story house.
Thank you. Can you also tell me about your closest relatives? Do you have any adults in your family, and what do they do for a living?
Yes, my mother is Isadora Morgenstern and she's a chef, while my father Lucian Morgenstern is a lawyer.
Thank you. Any other family members, like siblings or children?
No, it's just me.
Okay. What brought you to the hospital today?
I mentioned earlier that I've been experiencing pain in my lower back and left hip, and it's been getting worse. I'm also having difficulty walking, and my left leg feels weak.
I understand. Do you have any past medical history that you can tell me about?
No, I've never had any serious health issues before.
Okay. Can you tell me if there are any illnesses that run in your family, like heart disease or diabetes?
My father has hypertension, and my mother has asthma.
Thank you. Can you tell me a little bit about your social history, like your job or hobbies?
I'm a college student studying biology. I'm not working at the moment, but I do enjoy hiking and reading.
Okay. Do you smoke or drink alcohol?
No, I don't smoke and I only drink occasionally with friends.
Have you ever used any recreational drugs?
No, I haven't.
Do you have any allergies to medication or food that I should know about?
No, I don't have any allergies.
Can you tell me about your dietary habits?
Yes, I follow a vegan diet.
Thank you. Are you currently taking any medication or supplements?
No, I'm not taking anything at the moment.
Okay. I'm going to take your vital signs now. Your blood pressure is 120 over 80 millimeters of mercury. Your heart rate is 85 beats per minute, your respiratory rate is 16 breaths per minute, and your temperature is 37.1 degrees Celsius.
Okay.
Based on your symptoms and the imaging studies we've done, I suspect that you may have rhabdomyosarcoma, a rare cancer that develops from skeletal muscle cells. We will need to do further investigations to confirm the diagnosis. I will order some blood tests, a biopsy of the affected area, and a CT scan to see if the cancer has spread. Are you familiar with rhabdomyosarcoma?
No, I've never heard of it before.
It's a rare form of cancer that affects the skeletal muscle cells. We will need to start treatment as soon as possible to stop the cancer from spreading. We will be giving you a combination of chemotherapy and radiation therapy. Do you have any questions or concerns about the treatment?
Yes, I'm a bit worried about the side effects of the treatment.
It's understandable to be worried. The treatment can cause some side effects, but we will be monitoring you closely and managing any symptoms you experience. I'll prescribe some medications to help with any pain or nausea you may feel. In the meantime, we'll start you on analgesics to reduce your pain and keep you comfortable. We will also have a team of nurses and other healthcare professionals to help you with your care. We will provide you with all the necessary information about the medications you will be taking, the dosages, and how to manage any side effects. Once we confirm the diagnosis, we'll give you a more detailed plan of your treatment and discharge.
Okay, thank you, doctor.
You're welcome. We'll be with you every step of the way. Is there anything else you'd like to know or share with me about your health?
No, I think that's it for now.
All right. I'll be in touch with you once we have the results of the investigations. In the meantime, please let us know if you experience any changes in your condition or any new symptoms.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. My name is Dr. Jones. Can you tell me your name, please?
Hi, I'm Valentina Rossi.
Great. And how old are you, Valentina?
I'm 62 years old.
And what is your address?
I live at 23 Oak Street, Melbourne, Victoria, Australia.
Can you tell me what type of residence you have and what area it's in?
I live in a detached house in a suburban area.
Do you have any close relatives we should be aware of?
Yes, I have my husband, Mario Rossi, who is 65 and a retired construction worker, and my daughter, Lucia Rossi, who is 38 and a nurse.
Thank you for that information. Now, can you tell me why you're presenting to the hospital today?
I have a painful rash on the left side of my abdomen and back, along with a fever and fatigue.
I see. Before we proceed, I need to ask you some questions about your past medical history. Do you have any pre-existing medical conditions we should be aware of?
Yes, I have hypertension, hyperlipidemia, arthritis, and chronic kidney disease stage 2.
Thank you for that information. Is there any history of illness in your family?
My mother had a history of breast cancer.
All right, let's move on to your social history. Do you work, Valentina?
No, I'm retired. I enjoy gardening and cooking.
That's great to hear. Can you tell me about your drinking and smoking habits, or if you have any recreational drug use?
I don't drink or smoke, and I don't use any recreational drugs.
That's good to hear. Do you have any allergies we should be aware of?
No, I don't have any known allergies.
Can you tell me about your dietary habits?
I follow a low-sodium, low-fat diet, as recommended by my physician.
And what medications are you currently taking, including their dosages?
I take amlodipine 10 mg daily for my hypertension, atorvastatin 40 mg daily for my hyperlipidemia, and naproxen 500 mg twice a day as needed for my arthritis pain.
Thank you for that information, Valentina. Now, I'd like to take your vital signs, including your blood pressure, pulse, respiratory rate, and temperature. Based on your symptoms and vital signs, I suspect that you have shingles, a viral infection caused by the varicella-zoster virus. I'd like to perform some investigations to confirm this, such as a viral culture and PCR testing on a sample of your rash.
Oh, I've heard of shingles before. That sounds like it could be it.
Yes, it's a common infection that can be quite uncomfortable. If it is shingles, we'll need to put you on contact and airborne precautions due to its contagious nature. We'll also need to start you on antiviral medication, such as acyclovir 800 mg 5 times a day for 7 days, and pain management medication, such as acetaminophen 650 mg every 4 to 6 hours as needed. We'll monitor your vital signs regularly and make sure you stay hydrated and well-nourished.
Okay, I understand.
We'll also need to follow up with your primary care physician in a week to make sure you're healing properly. Is there anything else you'd like to ask or discuss, Valentina?
No, I think that covers everything. Thank you.
Great. Before we proceed, I need to inform you that shingles can be quite contagious, especially if you're in close contact with people who have not had chickenpox or the varicella vaccine. Therefore, it's important to avoid close contact with others until the rash has healed completely.
I understand.
Also, I'd like to inform you that shingles. If you experience any ongoing pain or discomfort after the rash has resolved, please let us know.
Okay, I will.
We will be providing you with antiviral medication and pain management medication, such as acetaminophen, and we'll monitor your vital signs regularly to make sure you're responding to the treatment. We'll also make sure you stay hydrated and well-nourished.
Sounds good.
Before you leave, we'll provide you with a discharge plan, which will include instructions on how to take your medications, how to care for your rash, and how to prevent the spread of the virus to others. We'll also provide you with a follow-up appointment with your primary care physician in a week, as I mentioned earlier. Please take rest and avoid strenuous activity until the rash had healed.
Thank you for your help, Dr. Jones.
You're welcome, Valentina. If you have any further questions or concerns, please don't hesitate to ask.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a conversation in which a surgeon discussing about a scoliosis patient with a nurse in the recovery ward. Now read the question.
Good morning, nurse. How is our patient with scoliosis doing in the recovery ward?
Good morning, doctor. The patient is doing well. They are currently resting comfortably.
That's good to hear. We performed spinal fusion surgery to correct their scoliosis, so I want to make sure they are comfortable and that their pain is under control.
Yes, doctor. We've been closely monitoring their pain levels and administering pain medication as needed. The patient hasn't reported any significant pain since coming out of surgery.
That's excellent news. I also want to make sure that their vital signs are stable and that they are not experiencing any complications.
I've been monitoring the patient's vital signs every hour and everything seems to be within normal ranges. The patient has been resting quietly and I haven't noticed any signs of complications so far.
Thank you for the update, nurse. Keep a close eye on the patient and let me know if there are any changes in their condition.
Will do, doctor. Is there anything else I can do to help the patient?
Just make sure they are comfortable and that they are getting the rest they need to recover. I'll check in on the patient later today to see how they are doing.
Sounds good, doctor. I'll make sure they are well taken care of until then.
Now look at question 26. You hear a conversation in which a trainee doctor asking supervisor advices about balancing patient care with administrative tasks. Now read the question. Now look at question 26. You hear a conversation in which a trainee doctor asking supervisor advices about balancing patient care with administrative tasks. Now read the question.
Good morning, Dr. Smith. I wanted to talk to you about balancing patient care with administrative tasks. I feel like I'm spending a lot of time on paperwork, and I'm concerned that I'm not spending enough time with my patients.
Good morning. Yes, that's definitely a common problem for doctors, especially in the early stages of their career. What specific administrative tasks are you struggling with?
Well, I spend a lot of time documenting patient care in the electronic health record, which takes time away from interacting with my patients. I also have to keep up with coding and billing requirements, which is a whole other set of tasks.
I understand. Documentation and coding are important parts of the job, but they can certainly be time-consuming. One strategy one uses is to try to document patient care in real time as much as possible, so that it doesn't pile up at the end of the day. I also try to delegate some of the administrative tasks, such as coding, to support staff whenever possible.
That's a good idea. I also find that I'm spending a lot of time answering emails and phone calls from patients or their families, which can be distracting and time-consuming.
Yes, communication with patients and their families is important, but it can definitely eat into your day. One strategy one uses is to block off time during the day for returning calls or answering emails, so that it doesn't interrupt patient care. It's also important to set clear expectations with patients and their families about response times and what types of communication are appropriate.
That's helpful. I'll definitely try those strategies. Do you have any other tips for balancing administrative tasks with patient care?
One important thing is to prioritize your tasks and focus on the most important patient care tasks first. You may also want to talk to other doctors or support staff to see if they have any tips or tricks for managing administrative tasks. It's important to remember that balancing patient care with administrative tasks is an ongoing process, and it can take time to find a system that works for you.
Now look at question 27. You hear a conversation in which an eye specialist talking to patient with age-related macular degeneration. Now read the question. Good afternoon, Mrs. Johnson. It's nice to see you again.
Good afternoon, Doctor. Thank you for seeing me.
Of course. How have you been doing since our last visit?
Well, I've been having some trouble with my vision. It's become blurry and distorted, and it's been affecting my ability to read and recognize faces.
I see. It sounds like your age-related macular degeneration may be progressing. Have you noticed any changes in your eyesight over the past few weeks or months?
Yes, it's definitely been getting worse.
Alright. Well, we'll need to take a closer look at your eyes to see what's going on. I'm going to perform a few tests, including a visual acuity test and a dilated eye exam.
Okay, sounds good.
Based on your symptoms, it's possible that you may have developed either dry or wet age-related macular degeneration. Dry age-related macular degeneration is more common and progresses more slowly, while wet age-related macular degeneration is less common but can lead to more rapid vision loss.
What causes age-related macular degeneration?
The exact cause is unknown, but it's more common in older adults, and there are certain risk factors, such as smoking, high blood pressure, and a family history of the disease. There's no cure for age-related macular degeneration, but we have treatments that can slow its progression and help preserve your vision.
What are my treatment options?
Depending on the type and severity of your age-related macular degeneration, we may recommend dietary supplements, injections into the eye, or laser therapy. We'll discuss the best options for you based on the results of your tests.
Okay, thank you, doctor. What can I do to take care of my eyes at home?
There are a few things you can do to help slow the progression of age-related macular degeneration and take care of your eyes. Eating a healthy diet that's high in green, leafy vegetables and fish, getting regular exercise, not smoking, and protecting your eyes from the sun with sunglasses or a hat can all help.
Thank you, doctor. I'll make sure to follow your recommendations.
You're welcome, Mrs. Johnson. Let's get started with your tests and come up with a treatment plan that works best for you. Now look at question 28. You hear a conversation in which a nurse asking a colleague for help with a patient with schizophrenia. Now read the question.
Hey, Sarah, do you have a minute?
Of course, what do you need help with?
I'm working with a patient with schizophrenia, and I'm having a difficult time communicating with them. They seem to be experiencing a lot of delusions and are very anxious. I was wondering if you had any tips on how to approach them.
Sure, I'd be happy to help. Have you tried using a calm and reassuring tone of voice when you speak to them? It can help to ground them in reality and reduce their anxiety.
Yes, I've tried that, but it doesn't seem to be working. Do you have any other suggestions?
You might also try validating their feelings and acknowledging their experiences, even if you don't agree with their delusions. This can help to build trust and rapport with the patient and make them feel more comfortable with you.
That's a good idea. I will try that and see if it helps. Thanks for your help, Sarah.
No problem. Let me know if there is anything else I can do to assist you. We are all in this together.
Now look at question 29. You hear a conversation in which a senior nurse is talking about a new chronic disease management program that has been introduced on the ward where the nurse works. Now read the question.
Good morning, everyone.
I wanted to take a moment to talk to you about the new chronic disease management program that has been introduced on our ward. As you all know, many of our patients suffer from chronic conditions, and it can be challenging for them to manage their health on a daily basis. That's where this new program comes in.
That sounds interesting. Can you tell us more about it?
Absolutely. The program is designed to help patients with chronic diseases, such as diabetes, heart disease, and cancer, manage their conditions more effectively. We'll be working with patients to develop personalized care plans that take into account their unique needs, goals, and preferences.
That sounds like it could be really helpful for our patients.
Yes, we're hoping that it will improve patient outcomes and reduce the risk of complications and hospital readmissions. In addition to the care plans, we'll be offering education and resources to patients to help them manage their conditions and improve their overall health.
How will we be involved in the program?
As nurses, we'll be playing a key role in implementing the care plans and providing education and support to patients. We'll be working closely with the rest of the healthcare team to ensure that patients receive the best possible care and that the program is a success.
That sounds like a really valuable initiative. I'm excited to be a part of it.
We're really excited about it too. We believe that this program has the potential to make a real difference in the lives of our patients, and we're looking forward to seeing the impact it has on our ward.
Now look at question 30. You hear make a conversation in which two speech pathologists are talking about a new speech recognition software that's designed specifically for speech therapy. Now read the question.
Hey there. Have you heard about the new technology that's being introduced in our field of speech pathology?
No, I haven't. What is it?
It's a new speech recognition software that's designed specifically for speech therapy. It's supposed to be a game changer in terms of helping patients improve their speech and language skills.
That sounds interesting. How does it work?
Well, the software uses advanced algorithms to analyze a patient's speech patterns and provide real-time feedback on things like pronunciation, intonation, and pacing. It can also generate targeted exercises and practice materials to help patients work on specific areas of their speech.
That sounds like it could be really helpful for our patients. Do you know if it's easy to use?
From what I've heard, it's pretty user-friendly. The software is designed to be intuitive and easy to navigate, even for patients who may not be tech-savvy.
That's great. I'm looking forward to trying it out. Do you know when it will be available?
I'm not sure of the exact timeline, but I know that the company that developed the software is planning to release it in the next few months. They are also planning to offer training and support to help speech pathologists get up to speed on how to use it effectively.
That's good to hear. I think this could be a really valuable tool for our practice, and I'm excited to see how it can help our patients improve their speech and language skills.
Me too. It's always exciting to see new technologies being introduced that can make a real difference in the lives of our patients.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Could you please introduce yourselves and give us a brief overview of what work involves at Thermo Fisher Scientific?
We both work within the field and safety instruments. Our latest instrument is the Thermo Scientific Ramina Process Analyzer, which makes process monitoring and optimization accessible, practical, and profitable. For some time now, we have been producing and supporting handheld instrumentation to perform incoming raw material ID and realize the maximum efficiency of a customer's incoming material ID and verification scheme. Our goal has always been to keep technology and instrumentation easy to set up and use, and retain robustness and field survivability to make our solutions more effective than current or historic testing methodologies. Our products empower and enable you to make rapid, trusted analytical and business decisions. We believe the Thermo Scientific Ramina Process Analyzer enables real-world cost savings you can expect when using Process Raman, as Thermo Fisher Scientific can help users achieve their process analytical technology strategic goals within the biopharma space.
What is process analytical technology, and how is it best implemented?
Process analytical technology covers a compelling area for us as an organization. It allows us to deliver clutch workflow and streamline process solutions within the biopharma space. Using process analytical technologies opens up a world of insight into a given bioprocess and provides the means to tackle problems as early as possible. Process analytical technology is not a new concept. Most larger companies are leveraging process analytical technology solutions at some point or another in their pilot and manufacturing plants. We believe that there is no reason why smaller, mid-sized biopharma companies cannot also leverage similar solutions. Process analytical technology can be used in several manners, such as offline or outline analysis, which requires sampling, and some automated analysis instead of manual wet chemistry. PATs may also be used as online and inline systems where the need to sample is eliminated. Process analytical technology is important for this industry. It matters greatly when challenged with tightening a process for FDA approval, when there is a strong need to beat out the competition in the market with rapidly developed therapies, or even when your goal is to implement practical process improvements and ensure product yields and costs are kept under tight control. We are well aware of some of the challenges faced by those in the biopharma field when implementing process analytical technology solutions. The end user needs to harness data for improved process understanding and control in real time. However, this is difficult when you need to take time to sample for offline analysis and risk potential contamination. It is even more frustrating when there are struggles with getting a newly acquired process analytical technology solution implemented in your flow. Users also need to be quickly and properly trained.
What is the value of having process analytical technologies available?
There is a clear value in having a process analytical technology solution, particularly one that can give you real-time actionable results while minimizing or eliminating contamination hazards. The real question is, why should you care that your data is available in real time? Just ask yourself, how much time is wasted when something goes wrong? It is extremely important to get things right the first time. Anytime you have to carry out work again is considered waste. How much money do you stand to lose because you did not have the right data to make a quick decision? It can be extremely difficult to recover when trust is compromised, especially with how rapidly information can travel and be shared in the modern era.
How can Thermo Fisher Scientific's technology help monitor inline R&D biopharma processes?
Our process analytical technology leverages Raman spectroscopy to see real-time changes. We speak with our customers directly and understand the urgent need to monitor inline R&D biopharma processes, both upstream and downstream. When a customer is equipped with a process analytical technology solution that enables a rapid knowledge infusion about any given process, it is then possible to closely control that process and boost the capacity of the existing development team in ways other than just headcount increases. Our customers can make those critical pivots when they have real-time access to actionable data. Our team at Thermo Fisher Scientific is equipped to provide expert assistance with implementing these process analytical technology solutions.
What current process analytical technology solutions is Thermo Fisher Scientific offering?
We have developed the Thermo Scientific Ramayana Process Analyzer, a small, extremely portable, robust Raman spectrometer. Raman spectroscopy uses laser light to generate spectral data that may be interpreted to determine target and light concentrations and identities. It is non-destructive and very specific when performing qualitative analysis. The presence of water has a negligible impact, which is ideal for aqueous matrices. Using an immersion probe and a fiber optic cable, Ramayana Process Analyzer can provide in situ bioprocesses measurements. A range of accessories is also available, such as a flow cell, if non-invasive analysis is preferred. Our extensive Raman portfolio includes Ramayana Process Analyzer, the XR3 Raman Flex system, and our handheld TrueScan RM handheld Raman Analyzer.
How and why is the new Thermo Scientific Ramayana Process Analyzer useful?
The Ramayana Process Analyzer is both small and not over-engineered, while the system is very intuitive as the user interface reduces the complexity of analysis and setup. Within 15 minutes, Ramayana Process Analyzer generates real-time actionable data for critical process parameters right out of the box. Ramayana Process Analyzer also enables better decision-making that impacts the bottom line by transmitting information within seconds or minutes rather than hours or even days, which is seen when using legacy techniques. The Ramayana Process Analyzer system is useful for obtaining rapid answers to key questions relative to bioprocessing applications where time to results is critical. For instance, potential application uses include metabolite analyte monitoring, such as looking at glucose lactate levels for upstream applications, and protein product purification in downstream processes. A couple of other applications include target product concentrations and cell density measurements. These are all applications where you must get the correct result quickly. Ramayana Process Analyzer allows users to collect and analyze spectra within seconds and tightens up process control parameters quickly.
Does implementing a process analytical technology solution, such as Ramayana Process Analyzer, positively impact manufacturing processes?
Yes, it does. For example, we recently had one real-world use case of the Ramayana Process Analyzer system compared to a legacy automated offline analyzer. This study was performed over 4 working weeks and examined the cost of upstream batch monitoring of a mammalian cell line. Using Ramayana, critical process parameters, such as glucose, pH, gas analysis, VCD, and cell viability, were all monitored using a single system. This approach facilitates rapid real-time eye-in-the-sky monitoring of bioprocesses with real positive outcomes. Cost-wise, we are talking about $80,000 in savings annually for glucose alone. That compounds into a $300,000 annual savings when using other critical process parameter tests that are eliminated because you are using Ramayana Process Analyzer. Armed with this knowledge, decisions on how to best optimize R&D headcount and instrument resources, including the resultant waste of those resources, can be made easily, especially when you are performing process improvements and know your current cost of business. Leveraging the unique nature of Ramayana Process Analyzer as a small, easy-to-use, and accessible Raman process analytical technology system creates a compelling business. Thermo Fisher Scientific can also be leveraged as a trusted source and resource for assistance.
Could you provide an overview of the type of performance and application utility users can expect from Ramayana Process Analyzer?
Ramayana Process Analyzer can be used for various applications in the biopharmaceutical industries, including for upstream and downstream processes, such as the purification of proteins and nucleic acids, or even for identification and characterization of finished products. There are challenges when monitoring and running conventional processes in a bioreactor. Bioreactors are used extensively throughout the biopharmaceutical industry, for example, during the manufacturing of monoclonal antibodies, and Ramayana Process Analyzer can help overcome some of these challenges.
What are the main challenges when monitoring and running a bioreactor?
The process of monitoring a bioreactor requires someone to specifically pull the samples,